5 years ago, when Animal Health Europe was still known as IFA Europe, we actually had a conference already on One Health, and the question was, is One Health just a buzzword? And we discussed what it meant by the term and what it involved. Now, 2 years ago, when the pandemic hit, I think all became very clear, and we became aware of what One Health actually means, and just how interconnected we are around the world, between humans and animals, between humans and the environment. And since then, policymakers, whether at international, European, national, or even local level, have been working hard to raise this topic high on the agenda.
Their place. But obviously One Health is a principle that we espouse to. It's very clearly in the Commissioner's mission letter. And I think it's a principle which we are starting now to see how it applies in practice. Obviously AMR is the area where we see it most clearly, and that we live on a daily basis. And the interesting discussions, if I can say it that way, that we've had on the implementation of the veterinary medicines regulation, which were very heated in the autumn. It was a hot autumn, Roxanne. It was a very hot autumn. I think showed just how much we need to try and join things up on that. But I would say there's probably a bit of scope for doing even more on that, both within DG Santé, but also, I mean, we have a nascent cooperation with other DGs on this. We have our Health in All Policies strategy, and I think on the food side now, we work very, very closely, obviously with DG Agri, with DG Environment on the farm to fork policy. Yeah? But I think there is certainly probably scope there for joining us up a bit more.
When we talk about One Health, always the first idea is, okay, One Health means that we have to work together. Mm-hmm. Intersectorial approach, and so on. But that is not enough to be together. For me, the second challenge is also working differently, thinking differently. Mm-hmm. It is not just an addition of policy or an addition of expertise. It is also how we use this expertise for working really through another approach. I'm a little proud about that because I do think that in a few months we develop a strong partnership, not only with FAO and WHO because we started to work with them now several years ago, but UNEP joined us recently. And in few months we have already developed a joint plan of action. We are now developing more developed implementing framework, and we are costing it. Because our objective is that in the coming months, we could submit this plan to resource partners, World Bank and other resource partners, so that next year, also, we could really open the pledge so that we could start to work. And the political momentum is also the appropriate one. Because the G20 presidency, initiated last year by the Italian, also established a joint group between Minister of Health and Minister of Finance in order to address also this issue of how they will, or how a resource partner will finance this One Health activities.
The creation of HERA, as I mentioned before, has been a very positive thing now in terms of preparedness and responding to emergencies. We have to see as well how we can really get a very good synergy and dynamic with HERA and working. I mean, obviously, when you set up a new service within the Commission, it's complicated, it takes a bit of time, and it takes time to recruit people as well. But I mean, they are now moving to having a number of staff and being able to respond, and certainly on the health countermeasures side, they're very engaged. I mean, there I see a bit more scope for work on surveillance. I mean, we have money from EU for Health that's going to go into surveillance on both the medical and the veterinary side. And hopefully when we get data from that, by then we'll have HERA up and running and also able to engage in and collaborate in the process of what to do about how to join all that up.
The One Health approach has definitely gained the renewed traction and its high political attention in the context of the COVID-19 pandemic. In September last year, the Pan-European Commission on Health and the Sustainable Development Commission that was chaired by the former Prime Minister of Italy, Professor Mario Monti, called for operationalization of the concept of One Health in all settings where the health and the well-being policies are developed. I've heard during the morning discussion that it is very important to operationalize the concept of One Health. But it will require actually the collaboration across all relevant sectors, which we've heard importantly at the national level in the animal, human, and the environment interface, as one sector alone or the one discipline alone cannot address the issues we are facing. And this is actually one of the key recommendations of the Monti Commission report. Now, in the WHO European region, which covers, as you said, so many member states, the 53 member states in Europe and Central Asia, we work very closely and coordinate our actions with the OIE as well as the FAO and the UNEP, and through the quadripartite regional One Health coordination mechanism. And through this mechanism, we define the strategic directions and the priorities for operationalization of One Health, as well as the coordinated technical support to member states.
We are a collaboration, a consortium between 43 institutions in Europe in the field of animal health, human health, and food safety. So you already see how there is a piece of the budget which is lacking there. However, what we have worked on for the future of One Health, especially focusing on Europe, is of course the know-how, the technical tools, because we do research, we do integrative research. We see how, for example, surveillance system could be interoperable, data could be interoperable, harmonization of approaches, and so on. We fund a lot of training activities and education activities. This is something that sometimes is missing from the discussion, but I think it's crucial because really we form the next generation of One Health experts. Those will be people that are experts in their respective field, but their core value will be One Health.
I don't know, first, how many people have a clue, how many people know about One Health, which is relatively simple as a concept. I mean, the health of animals, people, and the planet, and the environment, sorry, are connected, of course, but I don't know how many people know about that outside of this, of the sector, and when you go, you know, on regular people on the streets. And honestly, as a journalist, I don't know how many journalists have a clue about that. I don't think I've ever, I mean, I barely seen somebody writing about One Health, not writing about agriculture or environment. So it's quite complex because then there are many realities, let's say, with their own clear agenda spreading a lot of disinformation at one side, or misinformation, even worse.
if we want to really have a good advocacy campaign, it's clear that you need simplified messages, because we can't present everything in one go, but make it relevant. This is the thing, that if somebody finds your information useful, they're more likely to use it in what they're doing, and therefore that's how you get the impact at the advocacy stage of this communications plan. In addition to that, I'd probably add that there's also another way which I think is really important, and that has to do with the funding mechanisms. So when, for example, the EU, through the EU for Health program, decides that it's going to fund One Health projects, that's a clear opportunity to define what sort of gaps there are, and then with that to drive policy later. And I do find that, Robert, just one thing, that there again I find that the impact, the representation of environment is missing. For instance, it's such a clear need that there needs to be more balance there. But that's something that one could campaign for example, and try to build a little bit more communications around that. And I think the agencies, the EEA and UNEP and others will do that.
On the policy side, I think, yes, we have to go upstairs. How you get people talking, I mean, we've seen last year and more recently, you know, with vested interests who are basically trying to drive a wedge between the human and the animal health side within the EU, which unfortunately is very unhelpful. But I loved the question. I think that was a great question about universities. You know, as far as I know, pretty much every veterinary university in the EU will have a medical university associated or on the same campus. And yes, I think if you could encourage a collaborative approach in university, so we can get away from the us and them. You know, as vets, we've been through massive changes in the last 25 years, particularly to do with MRLs and losing active ingredients. And the message I take from that is that nothing is gained by banning or stopping a group of people from using something. There's got to be a collaborative approach.
The most critical topic we are working with is the informal markets, or vet markets, and with that the wild meat or bush meat. If you take this, all the particular after Wuhan and COVID, many say, you know, this market should be closed. We believe these markets are essential, important to feed the poor people in rural areas, but also the poor people in urban areas. So it's very important to keep them, but we need to improve them, and that's an important part. We have developed a graph where we show the 7 ways to invest in One Health, and this is true for Africa, it's true for all of the world. And you know, just only before the pandemic already, $1 invested in One Health actually generated $5 benefits for the health and public health. So there's a very close, and it's the cheap way, and we don't need, again, to have trillions lost because of a pandemic.
We can all agree from today that One Health is a global concept and requires global action. It's always good to get a reminder that what we decide here in Europe, while welcome and needed, must be adapted to the specifics of other regions while promoted as best practice. And thank you, Dieter, for highlighting this important point. Animal health is our health, it's everyone's health. This is a phrase we have heard from the recently rebranded World Organization for Animal Health. This is a belief that we in the animal health industry all share. We have a similar saying at Animal Health Europe, animal health matters. But what do we mean by that? Well, around you today, or on the screens if you're watching online, you'll see a number of photographs with some actions noted on them. These aren't simply nice messages and token phrases to decorate the conference room. In November last year, the Animal Health Europe team reviewed our strategic focus and agreed on 3 key areas for investment and action: innovation, sustainability, and One Health. With a more coordinated research and development, and with a well-concerted action and development solutions in these areas, we aim to deliver on protecting against disease shared by animals and people, secure a safe, sustainable, and affordable food supply, support sustainable food production, address antibiotic resistance with good stewardship, protect against vector-borne diseases, and just as important, enhance mental health and social inclusion.